Turnhout.
Thank you. My supplementary questions. In relation to question 12, I was very surprised when I first came into this role to find out that there are no independent inspections of residential services for people with disabilities, particularly for children, given what we know about the past, about institutional abuse. And to be honest, I'm astounded. So I've been trying to pursue this question. And in the answer that I received, it's not clear. In the reply it said that HICWA is engaging in this process, unifying the draft standards. And I'd like to get confirmation about what this means. Does it mean, number one, that HICWA is unifying the national quality standards for care services for children and young people with the national quality standards for residential services for people with disabilities, in which case adults with disabilities will be included with all children and not just children with disabilities? Or is it, number two, will children with disabilities be taken out of the national quality standards for care services for children and young people, in which case the new unified standards referred to in the Minister's answers will just relate to children and adults with disabilities? And what is the time frame for this? Because on this question I've been pursuing, and I'm constantly being referred between the Minister for Health and the Minister for Children, and children are basically falling between the gaps. Secondly, in relation to the area of mental health, in the reply I've received about the interim review of the Mental Health Act, can the Minister confirm that there will be sufficient interplay between the new capacity law and the Mental Health Act? Because in my opinion it would be unacceptable if there would be any discrimination or exclusion of people detained or treated under the 2001 Mental Health Act. And also, I'm finding it difficult to identify how the €35 million is allocated to the promised projects. And further to the RTE News report of the 6th of June, will the Minister confirm that the 24 million of the 35 million designated to strengthen community mental health teams in both adult and children's mental health services will be ensured to ensure that at least one of each mental health professional discipline is represented, that the 404 posts designated for adult community mental health teams and child and adult mental health teams will be in place by the end of 2012, and that the staffing of the community mental health teams will be ring-fenced so that the staff resource cannot be withdrawn to be used elsewhere in mental health services. And finally, in relation to my question in relation to the National Dementia Strategy, and I very much welcome the confirmation that the consultation process will begin shortly. It will include key stakeholders. And my specific question is that will consideration be given in this process to developing a strategy also to focus on the needs of the estimated 5,000 citizens under 65 years of age with early onset Alzheimer's and their families?